Let's take a look at why pre-hospital IV fluids should not be used in the case of trauma. Penetrating trauma is anything that pierces the skin. The severity of damage to organs and vessels depends on the mechanism of the injury. Blunt trauma is trauma that results from compression or shearing force injuries and is the most widespread type of injury. In the pre-hospital environment, it is routine practice to administer IV fluids for treatment of trauma. However, administering IV fluids for trauma has significant complications and can cause more harm than good. I'm going to discuss two main theories as to why fluids should not be administered pre-hospitally. In major trauma cases, time is critical. Cannulating and administering IV fluids results in more time on scene, therefore more time to hospital. In some cases, the time it takes on scene to cannulate and administer fluids exceeds the time it would take to transport to hospital. The second theory is concerning patients who have stopped bleeding temporarily due to the body's vasoconstriction and hypertension response. IV fluids are used to raise blood pressure, which in turn keeps the body's systems working. However, in patients who have stopped bleeding, IV fluid administration will cause rebleeding. This is due to the rise in systolic blood pressure. There is significant evidence and research to suggest that not only is IV fluid therapy unnecessary for pre-hospital trauma treatment, but that it causes more harm to patients. A 2011 study conducted on the mortality rate associated with pre-hospital intravenous administration used data from 1.5 million patient records from over 600 major trauma centres. The results of their research concluded that there is a higher mortality rate in patients who received IV fluid therapy compared to those who didn't. In fact, the research demonstrated that there is an 11% higher mortality rate for those who received fluids pre-hospitally. In fact, of all trauma patients, there is no subset in which had a survival advantage for pre-hospital IV fluids. The study identified that the mechanisms of adverse outcomes of fluid therapy are associated with dislodgement of clotting factors, dilution of clotting factors, and acceleration of hemorrhage due to the elevated blood pressure. Particularly notable statistics include patients who had head injuries had a 35% higher mortality rate, patients who were stabbed or shot had a 25% higher mortality, and patients who had emergency surgery after being hospitalized had a 35% higher mortality rate.